Good afternoon. My name is Gabrielle Argenton, and today I'm going to be presenting the prolonged sun exposure effects on the skin. So many people enjoy going out on the sun and feeling the warmth on their skin. That could be by going to the beach, playing some sports, or just walking around through campus. But sun exposure goes way beyond a temporary tan. While it does provide a good source of vitamin D for the body, it does have long-term effects on the health and appearance of the skin. So we're going to begin by speaking about the short-term effects of sun exposure. We have more, but I'm going to speak about the three main ones, which are sunburn, peeling, and dehydration. So sunburn is when the UV rays reach your skin and they burn the cells, leaving you with a red skin, irritated, and kind of hot to the touch. A study conducted by Grinsrelch in 1979 suggests that the UV radiation damages the skin cells, which causes the redness and inflammation of the skin. We move along to the peeling. Peeling is actually a consequence of the sunburn. Sunburn happens when you stay in the sun from anywhere from 1 to 3 hours in the day. And then when you give it 3 to 5 days time, your skin begins peeling. This happens because when the UV light touches your skin, it damages the cells, the superficial cells. They do end up dying, and this is when the peeling happens. That's the superficial layer of your skin. The cells died, and then they start peeling off because they are no longer needed in the body. This leaves you with very sensitive and red skin, as we can see on the second image provided. And if you do return to the sun at the time with a sensitive skin peeled, it can result in hyperpigmentation. Now we move along to dehydration. Dehydration is when you stay for a period of 1 to 3 hours in the sun and your body starts losing a lot of liquids and electrolytes. A study conducted by the American Cancer Society in 2024 suggests that dehydration can lead to fatigue, dizziness, and high blood pressure. Now we are going to move along to speak about the long-term sun exposure effects on the skin. We have more, but I'm going to speak about the three main ones, which are skin aging, hyperpigmentation, and skin cancer. So as we can see in the first image representing skin aging, this is actually a 92-year-old woman who participated in a research, and for 40 years, she applied sunscreen only to her face and not to her neck. As we can see in the image provided, the skin on her face is actually very clear. It has little to no wrinkles, it has little to no hyperpigmentation, and little to no lesions. When we move down to the skin on her neck, we can actually see that it has wrinkles, it has a lot of hyperpigmentation, and it does have 1 or 2 lesions that she needed to end up checking at the dermatologist. So research by Rattay conducted in 2015 suggests that 90% of visible lesions, wrinkles, and hyperpigmentation occurred directly to not using sunscreen and being exposed to the sun for long periods of time. Now we move along to hyperpigmentation. Hyperpigmentation occurs when you are exposed to the sun for 1 to 3 hours a day for multiple days and multiple years. Hyperpigmentation occurs because when the sun UV hits your skin is triggered to produce melanin. When you are doing this for long periods of time, your cells can actually get confused and they can mutate. Some cells can produce more melanin and some cells actually don't produce melanin. This is what causes hyperpigmentation and is actually very difficult to treat and even out the skin tone once you realize it is on your skin. Then we move along to skin cancer, which is one of the more serious problems of prolonged sun exposure for over a long period of time. We have 3 different types of skin cancer, as we can see shown here. We have basal cell carcinoma, we have squamous cell carcinoma, and we have melanoma. Basal cell carcinoma is a skin lesion that occurs due to prolonged sun exposure for long periods of time, and it is a lesion that is red, it hurts a little bit to the touch, and it is elevated. Squamous cell carcinoma is actually another lesion that is caused by prolonged sun exposure, and it looks more like flaky skin, but it is skin cancer, and it needs to be treated once diagnosed. Now we get to move along to melanoma. This is actually one of the more aggressive skin cancer types, and if not treated when diagnosed, can metastasize and lead to full body cancer. So melanoma, a research conducted by Raymond in 2020 suggests that prolonged sun exposure and melanoma risk are directly correlated. So the more you stay in the sun, the more likely your chances of developing melanoma are in the future. Now we move on to strategies to reduce UV exposure to the skin. These are the three more common and easily accessible strategies for everybody to protect themselves from the UV. And we have sunscreen, protective clothing, and time management. So sunscreen. Research conducted by the Skin Cancer Foundation in 2023 shows that by applying sunscreen to your skin while exposed to the sun, it reduces your chances of developing squamous cell carcinoma by 40%, and it reduces your chances of developing melanoma by 50%. This is what research shows. And it suggests that you use 30 SPF or higher. Now we move along to protective clothing. Protective clothing includes using hats, sunglasses, and light attire on the sun so it can directly cover the UV from passing and touching your skin. And then we move along to time management. So the UV is usually higher from 10 a.m. to 4 p.m. So if you use time management wisely, you can catch the UV index at a lower rate, which consequently will not give you these long-term or short-term effects of sun exposure to your skin. To conclude, sun exposure has both immediate and long-term effects on the skin, including the appearance and health over time. While it helps health-wise producing vitamin D, excessive exposure can lead to changes from sunburn to long-term and structural skin changes. Understanding these effects can lead individuals to make informed choices on whether to go to the sun and how you will go to the sun, protecting yourself or not. So now I will open up for questions if anybody has any.
I have a question. I would like to know how often I should be reapplying my sunscreen.
Okay, so research suggests that you should reapply sunscreen every 2 hours when exposed to the sun. But if you are in the sun and you are swimming, you're sweating, and you're doing anything, including wiping your face, you should actually reapply it every hour to make sure you're getting the full benefit of the sunscreen protecting your skin from the UV rays. And does anybody else have any other questions?
My question is, can you get sun damage on?
Yes, you can actually get sun damage on cloudy days. Study shows that 80% of UV rays still pass through the clouds to your skin on these days, so it's actually suggested that you also still wear sunscreen to protect your skin from these UV rays. I would like to thank you all for participating in my presentation today. Thank you so much.